Thank you very much. Thank you so much for having me. This is lovely. Just in awe of this building and all of you. Everyone is so nice and so kind. So thank you so much for allowing me to come. I'm a doctor of physical therapy. Usually I meet my patients when you're in pain or when something's gone wrong or something like that. So but this speech is more about just general how to be a good human being. I mean, how to navigate our complex bodies and this life and things like that. So hopefully it's something a little bit different than you've seen before. So I'm going to talk a little about just like what is health, some health, health statistics, what do physical therapists do, importance of exercise. I'm going to talk a little bit about sleep, a little bit about nutrition, a little bit about breathing, a little bit about golf, or if anyone likes to enjoy golf, pickleball, rotary sports, things like that.
Rotary sports.
You like to see what I did there? Oh, you caught it. So thankfully, you introduced me. I've been a doctor of physical therapy almost 15 years, sports medicine, orthopedics, neurology, vertigo, pain management. I'm lucky that I worked in New York. I worked with chronic pain patients for a long time. Working with people in constant pain is different, I think, than working with other patients. That led me down the road to become a yoga teacher and work on breath mechanics and things like that. Pain science, working with those challenging patients, I think, who've been in pain for years. I interact with a multitude of patient populations, to 7-year-olds to 85-year-olds to everyone in between. Head, shoulder, knees, and toes, right? Pretty much everything. I educate. I say I'm mostly just a teacher. I don't like when people tell me they've been to a physical therapy place and they just are put in a corner, squeezing a ball, and they don't know why, and and then they leave and they have no understanding of why they're there. So that kind of grinds my gears a lot. So I really try to educate about good health, proper exercise, lifestyle changes, recommendations. So hopefully, you leave my place learning something. When you work with me, I say you enrolled in school all over again because it's movement school, it's exercise school, how to take care of your body school, right? Certified yoga teacher, that helps me a lot where I can kind of incorporate that as need be. And it's fun to be a golf medical guy. I mean, I think the angle I take is I say I'm not a golf teacher, but I know what your body has to be able to do to hit a golf ball. So I take it as, I think your left hip is stiff, because this is stiff, you're not getting around, that's why you have elbow pain. Things like being a detective and understanding like, my elbow hurts, and I'm like, yeah, I understand your elbow hurts, but I think it's because of something else that might not be happening.
When you see somebody like that, do you ever have that urge to just say, you just suck?
I know. You never say that. You say, listen, you're limited. You gotta work. You got a lot of potential. Maybe something like that.
You're limited.
You're limited. Oh no, I say you're good, but you could do better. That's what I mean. You could do better. This is my office. If anyone's been on Danbury Road and Route 7, it's a pretty building. Lots of windows. Nice. So again, I treat a lot of different things, post-ops, chronic low back, neck. Like I said, I really emphasize education. I do a lot of the cool kind of manual things, Graston technique. If you remember Michael Phelps in the Olympics years ago, he had those big bruises on his shoulders. Yeah. That's cupping. I do a lot of that. I do dry needling. That's a whole other talk. I mean, if everyone's going to come in and talk about manual techniques, dry needling, things like that. I say it's nice to have all those tools in your toolbox. Everybody's different. I mean, I might use one thing on Amy and something different on Tom, right? It's just like, it really depends on the person. I'm just treating the individual in front of me, so it kind of depends. So what is health? How do we define it? I say it's a combination of physical, emotional, and mental well-being. It's a mind-body connection. When I was a young therapist, I had a guy with low back pain. I couldn't fix him. I had no idea what to do. I tried everything under the book. Turns out he was going through a very bad divorce. He was stressed all the time, and when he started to talk to someone and he opened up about it, his back pain went away. So I didn't have to do anything, but I tried everything, and then you start to realize, I think the stress that people deal with this day and age, like technology, news, 24/7, everyone is stuck in this kind of state here, and how am I going to fix you if you walk around the whole day like that, and then you come to me, and so we have to tease that out, because I could teach you everything I know, but if you leave me in the other 23 hours of the day, you're stuck like that, it doesn't really matter, So you got to be able to explain to people in a nice way, like, listen, we have to work on this, you have to work on this, because if you're mentally stressed, your body's going to reflect that, your body's going to hold that tension. So, to me, I think that's why you need someone to maybe kind of work with you to understand which of these factors are playing a role, basically. It's an intricate relationship between diet, exercise, stress, culture, personality. I have people who are scared of exercise. I have people who are scared that exercise is going to hurt them. I've had, there's so many things I think that you got to kind of, look out for and educate people with. It's all unique to the individual. No one's cookie cutter. I'm going to treat you differently than you, even if you have the same injury. It really just kind of matters how they present. Health statistics. Americans have a shorter life expectancy compared with residents of almost every other high-income country. So we don't even break into the top 10. So it's just pretty sad. We're probably the sickest we've ever been as a country ever, and honestly, we're just getting sicker, which stinks. 4 out of 10 Americans are morbidly obese, while 7 out of 10 are overweight. Children now spend more than 7.5 hours a day in front of a screen. More than 80% of adults do not meet the guidelines for both aerobic and muscle strengthening activities, and more than 80% of adolescents do not get enough aerobic physical activity to meet the guidelines for youth. I think we all see it. It's, no one gets outside anymore. I mean, I'm lucky enough to grow up where, you had to go outside and play. You had to figure. No one knows how to be bored anymore. I don't think. Like, you have your phone. My mom would drop me off somewhere, and then I'll be back in an hour, and then you just had to figure out what to do, right? You have your phone, you could just be on your phone and an hour goes by. You don't know what happened, right? So I think there's something to the technology of it. But nearly half of U.S. deaths can be prevented with lifestyle changes. So what do? We need to evaluate and use proactive strategies to prevent the onset and progression of these chronic conditions. Obesity, diabetes, cardiovascular disease, hypertension. We can change a lot of that. A lot of that's in diet, a lot of that's in breath work, a lot of that's in exercise. So a lot of these things we can reverse. But it's just consistency and getting, I think, the right, kind of knowledge out there. The adoption of healthy lifestyle practices, including a healthy diet, physical activity, exercise, stress management, effective sleep. It's been shown to improve morbidity and mortality, delay the onset of these chronic conditions. As physical therapists, I feel like we're in the best position to do this because you come into me and if you're scared to work out, if you have all these different things, I can at least be the first person to give you a plan and say, I know you had shoulder surgery. I know you have a history of this. I know you have hypertension, but this is, to me, the prescription. This is where we start. This is what we do. So you can at least get going, I think. So I think physical therapists, hopefully moving forward, it should be more like a primary care thing. Usually people see me when they're hurt. I'd like to see people maybe when you're not hurt. I could just say, listen, I think it was Scott, he's going to climb a big mountain. He's like, hey Tom, I'm climbing a big mountain in 6 months. What can I do to prepare for this? Stuff like that.
Prepare?
Yeah, right. So I never see that, People are already hurt usually when I see them, right? So, or they've already had surgery, So maybe it'd be nice to, to be more on the prophylaxis prevention side, right? So activity levels for older adults, greater than 65, 52% of all adults do not meet the recommended guidelines for physical activity, 33% report no leisure time physical activity. This has metabolic and cardiovascular risks, obviously, increased BMI, reduced muscle mass. I don't care what age you are, gravity is going to pull on you constantly. Gravity is going nowhere. So, yep.
What are the guidelines for aerobic exercise?
Oh, we're getting there, don't we?
Oh.
Yeah.
2 hours a day.
I treat a woman, she's 93, and she's strengthening. I mean, you know what I mean? I'm not having her bench to her max or anything like that, but, there's cool studies. You see, like, a 75-year-old triathlete versus a 75-year-old sedentary person. Look at their fat tissue, look at their muscle mass. Like, the stronger you are, the longer you're gonna live, period, So, it's scary. I mean, I think, a lot of people were scared it's going to hurt us. But again, gravity's going nowhere. Exercise for your bones. Exercise to pick up your grandkids. Exercise, what's your why? I mean, it doesn't, but I say you don't have to spend 3 hours in the gym sweating into a bucket. I mean, it can be very easy. You can do strength training twice a week and still get the benefit. I think you just got to find the thing that resonates with you, build it into your life. It has to be habitual. And then poor balance, I think a lot of people think they just have poor balance, but it's not just that. Balance is strength. Like if I stand on my leg, I can feel my butt, I can feel my core, I can feel myself balancing here, versus a lot of people just think they have bad balance. And it's not just balance. Balance is, inner ear and proprioception, but a lot of it's strength too. So I work with a lot of my elderly people. I said, I need you to be able to get from here to get up off the floor, God forbid you fall down. You know what I mean? So why aren't we just teaching that to everybody? I don't understand, So why don't we exercise? People are scared. You've been in chronic pain, you've fallen, you've hurt yourself once. One of the most common reasons patients don't, want to exercise. They're scared it's going to hurt. They're scared it's going to make them worse. People have a recent illness or current disease. They think like something happened. They're shrinking. They're scared. Anxiety. They're not motivated. Again, some of my patients, they're like, I'm 85. Why do I have to do this? I don't need to do this. A lot of people are, scared because of a gym's like a very, it feels like it's complicated. They're self-conscious. You don't need a gym. It's really like, what do you like to do? Do you like to go swimming? How do we revolve around what we like to do? Can I make it easy? Can I build it into your life? It doesn't have to be so complex or complicated. All right, benefits of exercise. It prevents and manages 26 different chronic conditions. There's no pill on the market that does that. So it's just like, this is the best kind of drug we can take, but again, not everyone takes it, or no one likes taking it, it can extend life and mitigate the effects of chronic diseases, such as arthritis or diabetes. It can improve your coordination and flexibility. It can alleviate depression. It can improve your mood, increases your strength, works with diabetes, all the above, right? So here's your guidelines for activity. The minimal expectations on a regular basis, 150 minutes weekly of moderate intensity exercise, like brisk walking, for instance. What did Socrates say? If you feel bad, take a walk. If you still feel bad, take another walk, something like that. So, being active. Again, I tell my patients it's triple tier. Like, do something cardio, do strength work, do something stretching, mobility, breathing, calming down. Those three things are generally what I find. Like, I'll get a marathon runner, all they do is run, but they don't strengthen and they don't stretch. Or I'll get the yogi who comes in, they only stretch and they don't strengthen, So it's like you gotta kind of, navigate it. But for the most part, people are living like this. If I can teach you how to slow your heart rate, slow your blood pressure, you'd be so surprised how rib cage mechanics can help you to touch your toes. And, I can do a whole other talk and all that kind of stuff. But I think mostly you should have a little bit of calming yourself down, a little bit of you gotta strain yourself, because when you strain yourself, if life throws you a curveball, you've strained yourself before, you can deal with it. If you've never tested yourself, when that happens, it's a catastrophe. We break down and things like that. So although strengthening is uncomfortable, it's gonna prepare you for life. I mean, it's a scary but a necessary kind of feat there. Strength training twice a week. Again, I could give you 3 exercises. I don't care. 3 of them. But it's got to be tiring. If you're just doing this 30 times and you don't feel anything, it doesn't help. I need you to be like, okay, Tom, I'm going. Ooh, okay, it's getting tired. It's getting tired. I'm going to say, okay, Tom, how many did you do? 15. All right, do 15 3 times. Like we can simplify everything. It doesn't have to be crazy. I want to be able to pick up my grandkids. Like, I could teach you how to save your back. And so you just got to connect the dots. And I think that's why it's good to have someone to design a routine for you, I think. Gradual growth is better. Small bouts of 10 minutes or less, which grows over time. I tell people you can do a quota system. If you don't have an hour in your day, do 5 minutes here, do 5 minutes there, do 5 minutes there. By the end of the day, you still get better. It's the same process. So walking, again, lose weight, healthy heart, improved self-esteem, mood, you're getting outside, it tones your muscles, just the benefits of walking. If you needed to start somewhere, start walking. Go a quarter of a mile, and then do a quarter of a mile for a week, then go a half a mile, and then build yourself up slowly like that. At the very least, just getting the sunlight, I think, is enough to change your mood a lot of the time. Exercise and cardiovascular disease. People at risk for cardiovascular disease have a 72% increase in mortality with addition of physical activity. Physical activity in individuals with cardiovascular disease can reduce the risk of dying of a heart attack, having a non-fatal heart attack. Your heart is a muscle, so if we don't really work that muscle, the everyday life stuff adds up. And then if the everyday life stuff adds up, I think we're kind of putting ourselves at risk for something that we could have avoided. Physical fitness lowers your heart disease risk, it lowers your blood pressure, it can improve your cholesterol levels. One study showed a decrease in coronary heart disease for both men and women by greater than 20%, which is definitely significant. Cancer boosts energy and reduces fatigue. Exercise maintains muscle strength, it reduces pain, decreases brain fog, improves sleep, improves the effectiveness of your treatment. It's redundant, but it's just you know, I think we just really just need to be proponents for exercise. It can help on all accounts. The cool thing, I think, is exercise in the brain. There's changes in brain structure and function. When you exercise, you have improved frontal lobe activation, you have improved executive function, lower white matter atrophy, smaller white matter lesion volume. Exercise is the single most powerful tool you have to optimize your brain function. They did a study in Minnesota where there was a bunch of kids and they did physical education class before they started school. And all the kids who exercised before school did better on tests, performed better, their brain was wired before they even started, so there's definitely a connection between physical exercise and performance. So why aren't we having this in school? You know, it's like, what's the bigger picture? Like, how do we, you know, implement this? Kids sit at a desk for 8 hours a day, they're cutting gym class, like, so to me, I think there's a lot to like implementing this on a grander scale. I want to do it, I just don't know how to do it. So the importance of sleep. So sleep and health go hand in hand. I think everyone's heard of the lymphatic system, right? Lymph nodes, lymphatics. Your lymphatic system is your sewer system. Your body creates garbage, right? So the lymphatic system takes all the garbage away, it takes it to the sewer centers, the trash disposal, it gets recycled, right? The problem is your brain doesn't have one of those. Your brain doesn't have a lymphatic system. What it does, it recharges when you sleep. So if you don't sleep, your brain never shuts off. Your brain can never get rid of this accumulated garbage. So I talk to my patients all the time about sleep, and if you're not sleeping well, I got to figure out a way to try to help you to get more sleep or get you in the hands of someone who can help you to sleep better. A third of our entire life is spent sleeping, so that's, you know, a third of it. It's ammunition for the brain. It's housekeeping performed at night. If we don't sleep, the housekeeping never happens. Short-term memories become long-term memories during sleep. It inspires creativity, can rebalance emotions, it can help with fresh cardiovascular health, metabolic health, it can boost our immune system. Like, sleep is everything. I mean, I tell my kids, like, I mean, it's non-negotiable. You know, it's like, you know, we need sleep. You can't play, you can't do this, you can't do that without it. On a regular basis, poor sleep shortens lifespan and increases the risk for developing chronic diseases. Poor sleep affects your cognition, your mental processing, performance. It affects our emotions. It makes us feel sad. It makes us feel irritable. It's much harder nowadays, I think, with overstimulated culture of technology. We all have our phones on our bedside. We're on the phone to the very last minute, and then we put it down, and we try to, you know, you try to go to sleep right there. We've all been there, right? It's just funny to me too, like some of our most important jobs that we have, police officers, surgeons, they're all running on no sleep, you know? So it's just like funny to me, the people who have the most important jobs, you know, they work 24-hour shifts and, you know, you're performing surgery on me and you've only had 2 hours of sleep. I'm gonna pick a different surgeon, I mean, you know, okay, it is what it is. So, you know, people are overworked. Truck drivers, again, medical professionals, overnight shifts, the military. You know, my neighbor is a police officer, and like he'll work 12 hours, go home, sleep 4 hours, go back for another shift, and it's just like, I don't know how you do it, because you're also the stuff you see. He's just stuck in this, like, you know, how do you turn that off? Whatever he saw on that shift, he's lying there probably trying to sleep, and you can't turn it off. You know, I feel for those people. I mean, I think nowadays at least mental health is coming more to the forefront because they're asked, a lot of is asked of them, and I don't think they understand like the weight they carry, you know. So nutrition to me, it's such a convoluted, awful, like, you know, what do I eat? What is, you know, so I try to like tease it out as best I can, but the typical American diets, they exceed the recommended intake levels of limits in 4 categories. Calories from solid fats and added sugars, refined grapes, sodium, and saturated fats. So what that means, basically about 90% of Americans eat more sodium than is recommended. Should be about 2,300 milligrams a day, and most people eat 3,400. Decreasing it by 1,200 milligrams a day could decrease medical costs by $12 billion.
Wow.
So the problem, and this is my kind of take, I feel like a lot of medicine is we've created we're spending so much money treating the symptoms, we need to get to the source of the problem, and I think a lot of that's diet, where like basically the faucet's running and there's a leak and we're just mopping it up, like why don't we just turn the faucet off, you know? So I think just, you know, educating people on whole foods, no processed foods, like, you know, it doesn't have to be crazy, but you know, unfortunately our diet and what we put in our food is really affecting us, and again, it's affecting cognition, and now that enough time has gone by, they're making connections between what we put in our food and our brain and our performance and dementia, Alzheimer's, you kind of name it. So recent reports project by 2030, half of all U.S. adults will be obese. And I think when you're obese, if you have type 2 diabetes, it costs America, I think, over $1 million to treat one person with type 2 diabetes or something like that. Multiply that by, 115, I mean, it's staggering, Obesity-related illness, including chronic disease, disability, and death, is estimated to carry an annual cost of $190 billion. On to water. When people walk into me, I generally kind of ask if they drink enough water, the lips are cracked, or other kind of telltale signs, like we need water, and I think generally a lot of people don't drink enough water. It aids with cognitive function, it helps with nutrient absorption, it helps to create saliva, it regulates body temperature, it helps to lubricate all of your joints, your spinal cord, aids in perspiration, urination, maximizes physical performance. If you're dehydrated, your muscles don't work well. If you're dehydrated, whatever water you have is going to go to your liver, your kidneys, your heart. Your muscles and your joints are going to get shafted, pretty much, number one. So, we try to just, I think a lot of people think too. I know exactly. A lot of people think, Tom, but I don't want to be up all night using the bathroom. So try to just, front load it in the morning, front load it during the day. Just try not to drink too much, maybe after like 6 p.m. or something like that, so you won't be up using the facility or all like that.
Tom, how many ounces of water do you recommend?
Generally, I try to say like half your body weight in ounces. So if you're 100 pounds, you're shooting for 50 ounces. I know. Yeah. It seems like a lot. I think another good indicator is kind of look at the color of your urine. If it's bright yellow, drink a little more water basically. If it's a little more transparent, a little bit more clear, I think that's a good way to, kind of be a judge.
Diet Coke doesn't count?
Actually, it does, but I mean, you're going to get some other, I think the research is showing like you are going to get some hydration with the seltzers and the sodas and the teas and all that, but I think it's just everything else that's added on top of it that could be the bad part. So kind of transitioning a little bit, breathing, right? I think, why are we so concerned with breathing? You breathe like 25,000 times a day, or something like that. So I tell people how you breathe matters. Are you only breathing up here? Do you take a shallow breath? Can you take a full exhale? How much of an inhale can you take? Where's your rib cage? Do you look like this? Or do we look like this? Your rib cage is like a 360-degree structure, so you should be able to expand here, you should be able to expand here, you should be able to expand here. The fitness industry kind of screwed us over in the 60s or the 70s. We told everyone to stand like this, right? But when I do this, look at my back. Like, look at my whole center of mass is shifted, and then I end up like that. So, I teach people, I don't flow well here. If I can breathe in, you should be walking around like you're about to beat somebody up. It seems funny, but if I walk like this, my legs don't get behind me. Like, if I'm more here, my glute can push me through life. But we do this, if I go long enough like this hurts my back. And then people do this because this feels better. And then they say, Tom, like it hurts to stand up. I can't stand up. I'm like, because you gotta fix it from the bottom, and then you can get back up. For all the golfers too, you gotta get here, and then you take the back out of it. So why breathing? Because if I breathe, I can change my rib cage mechanics. If I can take a full exhale, I can collapse. Like that's how you would touch your toes. Everyone's like, I'll never be able to touch my toes, and it's mostly because they're stuck here. And then they go like this, and they feel it in their hamstrings. If I can get all this to move backwards, suck this in, you can start to do a lot of stuff. You can also use breath to stabilize. If I'm gonna pick up something heavy, a grandkid or something like that, if I breathe in, lock that in, I'm protecting myself. I'm not gonna use my back when I do that. You ever see Serena play tennis? When she serves, she screams.
Yeah.
She's breathing in, loading, and then exhaling. So then you start to learn how to breathe to create force and power and stuff like that. So breathing can calm you down, it can calm your heart rate, it can calm your blood pressure, but breathing can stabilize you. When you get really good at this, people who have back pain back here, if I teach them how to breathe, eventually I can lock in here and make them breathe back here. you know, and you can stretch from the inside out, but people don't realize the power of where you can direct your breath. It's kind of like aerodynamics, really. But again, it's just an unsung hero. Again, I don't think anyone needs to be a monk on a mountain to learn how to breathe, but you can use it. It's a very powerful tool. So, it delivers oxygen to our cells. You know, people can go weeks without food, days without water, but only minutes without air. It optimizes our body's internal environment. It improves our nervous system, cardiovascular health, lymphatic systems, anxiety relief. I take people, when I evaluate them, I make them take a deep breath, and I'm curious just how much can they exhale, you know? Some people are just living in this, they're like, you know, kind of like panting like a dog kind of thing, but if you can slow your breath, if you can at least make your exhale longer than your inhale, your heart rate's gonna slow down, your blood pressure's gonna drop, and you can enter the chill zone. Rest, digest, like hanging out, you know? We need to have that sympathetic state. You know, if God forbid a bear is chasing me, I need my heart rate, I gotta get out of here, you know? But most people, because of technology, stress, kids, whatever, we're all living here, and the heart's working so hard because they're not breathing well. That makes the heart rate go up, and I think that's what kind of wears people out over time. No one knows how to like slow the system down. No one knows how to turn on the off switch, basically, as I call it. You know. So I kind of look at people breathing. There's apical breathing, diaphragmatic, paradoxical. Technically, when you inhale, like the diaphragm you have basically one muscle in your body that's purely for breathing, and it's called the diaphragm. But the problem is like a lot of people don't know how to use the diaphragm. A lot of people are using like their neck muscles. Every time they breathe, they're shrugging their shoulders. So like you got to look at it as you're breathing 25,000 times a day. If you're using your neck to breathe, and you come to me and you have neck pain, how am I going to fix your neck pain if you breathe with your neck? You know, so it's like kind of thinking I need to get them to be able to take all this tension out of here and kind of, you know, redistribute it and make you just maybe overall like more efficient. Nose versus mouth. So your nose has nose hairs, your nose has cilia, your nose is a filtration system. Like when you breathe in through your nose, it humidifies the air going in is purified, it's lovely. Not saying that we don't need to breathe through our mouth. If you're exercising like crazy, you have to breathe through your mouth. If you predominantly breathe through your mouth, you're breathing in all the particles. My mouth is big too. Like my nose is small, so when I breathe, it keeps all the vessels nice and patent. All the tubes are basically nice and kind of like the air shooting through them, no problem. If I only breathe through my mouth, everything starts to slacken, everything kind of starts to get like saggy and stuff like that. So if it's hard for you to breathe through your nose, like I challenge you to try to get, you know, a little bit more in tune to it, only because of all those reasons. The diaphragm. So technically when you inhale, this is the diaphragm, this blue thing goes down as you breathe in, and then as you exhale, it goes up. It's like a parachute. It goes in and out, in and out. A lot of interesting things attached to this, so you'd be kind of surprised, like low back pain, other things. I can kind of talk a lot about breathing because I'm a nerd with it for a couple of years there, but it's a powerful thing. If you've never kind of like experienced your breath or kind of see how you breathe or paid attention to it, you know, it's a cool thing to look at. Everyone should have a movement practice which ties in coordinated and purposeful breathing. Like I don't tell people to stretch and count anymore. People tell you to like hold something for 30 seconds, you know, everyone's just counting 30 seconds and, you know, we're not paying attention. I teach my patients now to breathe. If you're breathing in and breathing out, like at least you're relaxed and the muscles can actually feel safe and start to stretch out. Versus if I'm just counting to 30, I'm more focused on counting, I'm drifting, I'm thinking this is boring, you know, so I think like if you start to stretch, just try to be a little bit, you know, more in tune to slowing your breath down. You'd be surprised that the muscles will actually kind of just, you know, retain a little bit more of that length. So I think moving forward, we need to prevent disease, not manage it. I think we have to get ahead of the problem before it occurs. The number one cause of morbidity are all diseases which can be prevented by changes to a healthy lifestyle. We need to treat the cause, not the symptoms. Like I said before, mopping the floor, but never turning off the faucet. I tell people it's never too late to start. You know, health is a journey which begins with small steps. I tell people, I might see them for 2 months, I'm gonna go run with this, come back to me in 2 months. You're always refining it, changing it, making things harder, making things easier. It's a forever journey. I hate to say, everyone's like, how long should I do my exercise? I say forever. I mean, unfortunately. If exercise is medicine, we're only going to take it if it tastes good. So find something you like. Maybe you like to walk, you like to play pickleball, you like to go hiking, you like to swim. I mean, to me, it's just whatever you enjoy. I think you just want to do what you enjoy, because if you like it, you're gonna go do it. Find a professional who can guide you through your concerns and develop a plan. I think physical therapy is hard. We're not all created the same. I think some people treat it certain ways. Don't give up on therapy, just find another therapist. Keep trying to find someone you resonate with, because they can be very helpful. They can get you on a plan, they can get you started. And I think like if they're kind of doing it from a good place and they're listening to you, like it can get you going, in the right direction. Find someone who creates realistic goals and tailors the program to you. Like if you want to pick up your kids and the PT is making you squeeze the ball for 3 months and you're not doing anything to help pick up your kids, I'd probably go to someone else. You never reach an age where your body stops responding to exercise. That's why I tell my 93-year-old, I'm like, you can still build strength. It doesn't matter how old you are. It doesn't matter what you've been through. You can always, make an improvement. Doing one slide for golf just because, this is a different talk, but so all my golfers, tennis players, things like that, basically I'm lucky enough that I was trained by the Titleist Institute. It's basically a company that talks to you about, they've studied extensively what the body does in a golf swing. I'm not a golf teacher. I'm not going to tell you to put your hands here or do this or do that, but what I do know is they surveyed PGA pros for years and years and years, and they know basically what the prereqs are, how much your hips should move, how much your mid-back should move, how your balance should be, where you should be strong. So when I work with my golfers, I basically assess their body. All golfers should be able to move their pelvis, right? The dream in golf is everyone can kind of create separation and be able to do this stuff, this stuff, this stuff. So the cool part that I get to do is I assess them in my kind of field, and I can say, can you touch your toes? Can you do this? Let me check your hip. Let me check your that. And what's fun is I can figure out basically what a golfer's misses just by what I find in their physical exam. So I might have some guy who's stiff in his mid-back and he's not getting enough turn. So I would say, all right, these are the stretches we're gonna do to open this up. This hip is tight. That's why when this is tight, you stand up in your backswing. That's why you come over the top. So you start to kind of say, wow, I come over to the top, but no one ever taught me why I come over the top. It's because your right hip is sore from a hip replacement and no one taught you how to get that mobility back. So that could be tennis, that could be pickleball, that could be anything, but my cool thing is again, I'm not a golf teacher, but I know you're not loading your hip and that's why you're hitting it this way. I could basically say, here's some stretches, here are the exercises, then you learn, how to get the feel. Most people in golf, the number one injury is right-sided low back pain, and again, it's usually because golfers are pushing from here versus dropping down and using their glute to hit stuff. A lot of people have elbow pain, and that's kind of like I said before, a lot of people just hit stuff just with their arms. Golf is all lower body. If you're not using your lower body, you're gonna pick it up somewhere else most likely, overusing something. Neck pain, hip pain, knee pain. So my fun thing that I get to do is again, not a teacher, but I'm looking at your body and I'm just thinking how are you hitting this ball? It's a violent thing. And I can just kind of, it's fun to dissect where people are getting their power from.
It's funny because Scott and I will go play a violent game of golf out there at 8 o'clock. But there's always Judy Bentley right here behind me hitting this effortless swing right into us the entire time, hitting a 2.5 hour round of golf. And
because I always say, when you relax in golf and you just do a little less, you're probably just leading with the lower body, and then that you don't have to swing that hard. You really don't have to swing that hard. But I think we all just want to kind of go for the gold, and again, we're trying to get too far back or something, but I've done the same thing. I've played with some, seasoned golfers, and again, they're up in their ripe 80s, but they hit it pin straight. It's effortless, So anyways, that's the title is for performance kind of gist there. I appreciate you guys. Thank you so much for having me. Hopefully it was educational, and if you have any questions, let me know. I brought some cards. I'm over in Wilton, but yeah, ONS, Stanford, Greenwich. So we're starting to do a lot more outreach, a lot more of this kind of stuff, and I love speaking. So thanks for having me.
Thank you.
One question.
Yeah, any questions? Yeah.
Do you have to have a prescription from a doctor to come and see a physical therapist, or can you just say, Hey, Tom, help me out.
So basically, it depends on the insurance. It's kind of like, say, for instance, like Medicare. Everyone gets 23 visits a year unless you've had surgery. A lot of insurances, you can come see me for 30 days or 10 visits without a prescription. Kind of depends on the insurance and things like that, but not in every case. No, you don't need a referral or anything like that. Yep.
I know it would be a less desirable way of dealing with it, but if you're having trouble sleeping, do you ever recommend a sleeping pill?
You know, it's not exactly my realm, you know, but I do recommend like talking through like what your schedule is after 6 p.m. You know what I mean? Like cutting the TV, blackout curtains, reading before bed, like doing all the little steps in between. I don't know. I think it's someone you probably want to kind of get someone to look at you at a whole and see all the medications, you know, maybe that you're taking, what your day to day is. Stuff
Maybe
like
lay
that.
off the 3 martinis, man.
Yeah.
Maybe.
I hate to say it. Yeah. Alcohol, unfortunately, kind of diminishes
Espresso
sleep as
martini,
well.
only in
But
pot.
I'd probably say I wish I had one kind of silver bullet, you know, that I think could help everybody, but it's kind of, I guess, individualized, you know. But
Well, I think the best silver bullet is exercise. I mean, I find the more I exercise, the better I sleep. You're exhausted. It's like
Exactly.
going to bed and you just crash. So,
I agree. I
you know,
think exercise.
Take a walk around Waverly Park.
Yeah. That too, like no TV, no screens, like at least an hour before you go to bed. That blue light is stimulating you, and so you know you try to just wean down from that. Maybe read chamomile tea. I don't know. Yep.
So you mentioned the best time to exercise would be in the morning. And what about later in the evening? Does that kind of disrupt your sleep pattern if you exercise?
I wouldn't say, you know, timing of exercise, I wouldn't say there's anything that's better. I think generally in the morning we're all stiffer. You know, we just slept 8 hours a day, you know, or 8 hours a night rather. So I think the morning's a good time to like kind of reset, do some broad space stretches, get yourself ready. If you're dealing with an injury, I think it's important to wake up a little bit earlier and I call it like taking inventory. You know what I mean? You wake up, you're like, okay, like how am I feeling? Like let me do a couple of my favorite stretches and things like that. Exercise, I tell wherever it's convenient. I wouldn't say that it's worse to exercise later in the day. I think it's a myth that if you exercise right before bed, you're going to be awake, that you won't fall asleep. That's totally a myth. Yeah, no, that's not true. Yeah, it actually might help you. Yeah, it might actually help you.
Sorry, I asked that question.
Yeah, to your question, timing doesn't matter. Timing doesn't matter. I think it's just more of a schedule thing. For some of my people, the only time they can do it is in the morning. They want to get it out of the way when they get home. They want to be done. They want to be relaxing. Some people have to do it after work. Some people do it at night. As long as we're doing it, I don't think it really matters all that much. Yep.
How,
So besides after sugar and trans fats, what would be your worst 5 foods? The 5 foods to avoid the most?
Yeah, I mean processed foods 100%. I mean the empty carbs, I don't think a lot of people are just getting whole foods, whether it's vegetables, you know, fruits, things like that. I mean processed foods, unfortunately soda is going to get a terrible rap, obviously, the Coca-Colas, the Diet Cokes and stuff like that. Yeah, I mean if I just had to kind of tap it, top 5, I mean I would just lump most of it into processed, I think, you know, and just kind of tease it out from there.
Any more? Tom, thank you so much.
Yeah, of
for
course.
joining
Thank you
us.
very much.